Good morning, doctors. We are from SGD B10. We will present our student project about eating disorder, the intense fear of gaining weight, emerging eating disorder, of anorexia nervosa in psychological and medical aspects. And here, our group members.
Hello, my name is Putu Anggi Praditia Putri. My last three digit of my student number is 067. And today I'm going to explain about the background parts of this student project, the anorexia nervosa, the fear of gaining weight. Today we have so many beauty standards around us for having a good looks, a skinny body that makes everyone loves us as a pretty or beautiful girl. So this really relates to the anorexia nervosa disorder, that is a disorder that makes the patient restricted nutrient intake, so it's related to gaining weight, and this leads the patient to lose many amounts of weight, and the patient with this disorder basically will have a fear of gaining weight. Data in Indonesia does not really show the exactly amount of this disorder, but we have the data that show the adolescent around 15 to 19 years old have the highest rates of this disorder. Compared to the general population, anorexia nervosa had the higher rate of all cause mortality, and among all eating disorder, anorexia nervosa has the highest fatality rates, and suicide is more common in anorexia nervosa patients, and it counts for 25% of related deaths. And anorexia nervosa also has so many complications besides the psychological effect, example gastroparesis, constipation, and also myocardial atrophy. So this has the big challenge for the healthcare professionals, included doctor, about intervention strategies and also bring awareness of this disorder nowadays. So the student projects aim to delve into the intricate interplay between the medical and also psychological aspects of this disorder or anorexia nervosa by examining the factors contributing to its emergence and the complex dynamics. And also, this knowledge we hope can inform the healthcare professionals, policymakers, and the general public to develop more effective prevention, intervention, and also support system for individual affected by this debilitating condition. That's all about my presentation for today. Thank you.
My name is Dewa Angelica. With my last three digits of my name is 098. So I will explain about the problem foundation, benefits, and purpose of this student project. So the problem foundation of the student project are: what is anorexia nervosa? What is the epidemiology of anorexia nervosa? What are the causes of anorexia nervosa? What is the pathophysiology of anorexia nervosa? What are the medical aspects of anorexia nervosa? What are psychological aspects of anorexia nervosa? And the last is, what are the early intervention and prevention programs of anorexia nervosa? Next is the general purpose of our student project is to know the eating disorders that arise from anorexia nervosa in the medical and psychological aspect. And the specific purpose of our student project are to define anorexia nervosa, to explain the epidemiology of anorexia nervosa, to explain the cause of anorexia nervosa, to explain the pathophysiology of anorexia nervosa, to explain the medical aspect of anorexia nervosa, and to explain the psychological aspect of anorexia nervosa. And the last one is to explain the early intervention and prevention programs of anorexia nervosa. And the benefit of our student project is to improve knowledge about regarding the eating disorders that arise from anorexia nervosa in medical and psychological aspect. This student project will also help undergraduate to learn more about the clinical skills needed to become medical professionals, and we hope this student project will contribute to future science. That's all from me. I'll give it to my friends. Thank you.
Okay, thank you so much for the opportunity. First of all, let me introduce myself. My name is Rahel Juliana Manurung, which relates to my student ID 020. So before we start the discussion, let me explain a bit about the definitions of anorexia nervosa. The definitions of anorexia nervosa, so it is stated that Anorexia nervosa is a food intake disorder. It is defined by an unwillingness to maintain a healthy body weight and an exaggerated fear of gaining weight because of the skewed self-image. Based on the DSM-5, it is stated that anorexia nervosa is limiting energy intake and compressions to need results in a significant low body weight as compared to the individual's age, sex, developmental trajectory, and physical health. Also, severe aversions to gaining weight or getting fat, or a steadfast engagement in habits that prevent weight increase. That's all for me. Thank you.
Hello everyone, my name is Natasha Putri with the last three digits of my student number 083. Now I will explain about the epidemiology of anorexia nervosa. Anorexia nervosa is an eating disorder that primarily occurs in adolescents between 15 and 19 and has the highest mortality rate of all mental illness. It is because anorexia nervosa inhibits growth and development and causes chronic malnutrition. In 2014, the rate of people suffering from eating disorders in Indonesia ranked fourth after India, US, and China. In Indonesia, 2017, up to 0.2% of women and 0.1% of men had anorexia nervosa. There is initial evidence that the peak age of teenagers with anorexia nervosa have decreased over the last decade. In 2010, the peak age of the disease was from 12 to 15 years old, and in 1995 it was from 16 to 19 years old. Regarding gender, the anorexia nervosa cases in male-female ratio is around 1 in 9, which may reflect the underdiagnosed anorexia nervosa in boys. That's all from me. The next material will be brought by my friend. Thank you.
Okay, good morning, doctor, and good morning, friends. Let me introduce myself first. My name is Kadek Asri Bintari, with the last three digits of my student number are 063. Today, I would like to present about the etiology of anorexia nervosa. Here are some of the factors that cause anorexia eating disorder. First, the biological or genetic factors. The genetic component is one factor that has a fundamental role in causing anorexia. The second is the psychological aspects. The diagnosis of anorexia tends to be made in people with low self-esteem and self-evaluation. And the last one is the environmental influences. The severity of dieting is associated to culture in some countries. That's all from me. Thank you.
Hello everyone, my name is Cendrawan Han Santoso with the last three digit numbers 170. Next, we are going to discuss about the pathophysiology of anorexia nervosa. Anorexia nervosa is a disorder of low or minimal body weight with no interest in gaining weight. Gaining weight, or characterized by eating food, are controlled by several systems in the body. In anorexia nervosa, these systems are different, such as a disturbance in the serotonin system, an increase in dopamine that rewards exercise and diet, which results in self-starvation, and there are lesions in the brain that affect the appetite-regulating hormone. Anorexia nervosa also affects major organ system due to lack of nutrition, with the major concern being the cardiac system that may cause sudden death due to electrolyte imbalance.
Hello, my name is Nadia Ernestin Pari, and the last three digits of my student number are 155. And today I'm going to explain about the emotional factors that can affect anorexia nervosa. Anorexia nervosa is heavily influenced by emotional factors, leading individuals to feel that they are overweight even though they're already underweight. Low self-esteem, shaped by societal body ideals, further contributes to anorexia development. This condition can emerge at various life stages, but is often found in adolescent time, a time of emotional and social challenges. Family dynamics, social influences, and exposure to idealized body images, especially through social media, play a very important role. Anxiety and depression can also trigger anorexia by affecting appetite and distorting body perception.
Hello, my name is Lyshanda Kusuma with the last digits of student ID is 025. Now I will explain about cognitive factors of anorexia nervosa.
Cognitive factors. Several lines of research have suggested that poor cognitive flexibility, high levels of perfectionism, and meticulous attention to detail may act as a risk factor for the development of anorexia nervosa. Examples of poor cognitive flexibility in anorexia nervosa often include strict calorie counting, dietary rules, and intense exercise routine. A lack of cognitive flexibility is thought to contribute to rigid thinking and behavior, making many people resistant to change, resistant to treatment, and prone to relapse. When compared to healthy controls, adolescents and adults with anorexia nervosa had higher levels of perfectionism, which may be a risk factor for longer illness duration. Perfectionism has also been recognized as a need for control over their own body and self. Eating anything other than a very limited selection of safe foods is regarded as a failure in anorexia nervosa. Thank you, and next slide.
Hello everyone, my name is Jile, Fitria, Ateta, Ginting, and the last 2 digits of my student number is 140. So the diagnostic criteria according to DSM-5 is first, limiting the energy intake, resulting in very low body weight in the context of sex, age, developmental trajectory, and physical health. Second is intense fear of gaining weight, although they are very underweight. And the last is disturbance in how they perceive their body weight or shape and its impact to the self-esteem or the denial of their very low body weight. And it needs to be specified whether they are first the restricting type where they don't experience purging or binge eating, and the second is binge eating or purging type where they experience binge eating and purging. And it needs to be specified the severity, whether they are mild, moderate, severe, or extreme.
Okay, now let me continue. First of all, let me introduce myself. My name is Hannah with the last 3-digit number of student ID number is 236. And now I'm going to tell you about the physical health consequences in anorexia nervosa. Anorexia nervosa is a serious and potentially life-threatening eating disorder characterized by an intense fear of gaining weight and a distorted body image, leading to extreme restrictions in food intake. The physical health consequences and complication of anorexia nervosa can be severe and may include: the first one is malnutrition. Anorexia often leads to severe calories restriction, which can result in malnutrition. This can cause a range of health problems, including muscle weakness, fatigue, dizziness, and brittle nails and hair. And next is cardiovascular complication. Anorexia can lead to heart problems such as bradycardia, slow heart rate, arrhythmia, irregular heart rhythm, and even heart failure. The heart muscle can weaken due to the lack of essential nutrition. And then the next one is gastrointestinal issue. Anorexia can cause digestive problems such as constipation, bloating, and abdominal pain. It may also lead to gastroparesis, a condition where the stomach doesn't empty properly. Next one is osteoporosis. Insufficient nutrition can result in bone loss, leading to osteoporosis. This makes bones brittle and prone to fracture. Next one is electrolyte imbalance. Anorexia can disrupt the balance of electrolytes in the body, which can lead to dangerous conditions like hypokalemia, low potassium level, hyponatremia or low sodium level, and hypocalcemia or low calcium level. This imbalance can affect heart and muscle function. Next one is endocrine disruption. Anorexia can disrupt the endocrine system, leading to hormonal imbalance. This can result in irregular or absent menstruation in females or amenorrhea and changes in sex hormone level. In severe cases, this can lead to infertility. Next one is hair and skin problem. The lack of essential nutrition can cause thinning hair loss, and dry, brittle skin. Next one is immune system weakness. Anorexia can weaken the immune system, making an individual more susceptible to infection. Next one is neurological complication. The brain can be affected, leading to cognitive impairment, memory loss, memory problem, and mood disturbance, including depression and also anxiety. Next one is lanugo. In some cases, fine, downy hair known as lanugo may grow on the body as the body attempts to conserve heat due to insufficient fat stores. Next one is complication of rapid weight loss. In cases of rapid weight loss, there can be a risk of refeeding syndrome when individuals start eating again, which can lead to fluid and electrolyte imbalance, cardiac arrhythmia, seizure, and even death. And the last one is death. Anorexia nervosa has one of the highest mortality rates of any psychiatric disorder, primarily due to complications like heart failure, electrolyte imbalance, and suicide. And it is crucial to recognize and seek treatment for anorexia nervosa as early as possible to prevent these physical health consequences from becoming severe and irreversible. Treatment typically involves a combination of medical, nutritional, and physical psychological intervention, and it is essential for individuals with anorexia to work closely with healthcare professionals to address both the physical and psychological aspect of the disorder. And that's it for me. Thank you.
Hello, my name is Ananta Wismaya with the last digit number of 198. Now I'm going to explain about medical treatment of anorexia. When addressing anorexia with medication, one of the antidepressants that is used is Prozac, where this medication is part of the SSRI family. Prozac can help with depressive symptoms and potentially with healthy weight maintenance once weight restoration is achieved. In addition to SSRI drugs, atypical antipsychotics are also used in the treatment of anorexia. Zyprexa and Seroquel are one of the most prescribed antipsychotic drugs. This antipsychotic medication has been shown through research to induce weight gain and help lessen the frequency and intensity of intrusive anorexic thoughts. This medication, especially Zyprexa, can be used to assist with weight gain and obsessive thinking in patients and are effective in reducing agitation and distress during the weight restoration process. Maybe that's all from me. Thank you.
Okay, thanks for the opportunity. Before I start, let me introduce myself. My name is G Mahapraja Divasta with my 3 last ID number 02H. In this section, we will talk about early intervention and also preventive programs of anorexia nervosa. Okay, so here anorexia nervosa is one kind of eating disorder that hard to detect. The management was delayed and caused high mortality and morbidity. Preventive programs and early intervention are needed to reduce the severity of the disorder and prevent relapse. So for the early intervention, there are two. First one is acceptance and commitment therapy, or ACT, which is intervention on the importance of acceptance in mindfulness in dealing with the maladaptive behavior, and also DBT, or dialectical behavior therapy, which is helping people accept the reality of their lives and their behaviors. So for the next is preventive programs. On the other hand, we can also do preventive programs for individuals with suspicion of anorexia nervosa. The programs include, the first one is cognitive dissonance-based programs, which is aimed of creating a distraction that can reduce a patient attraction to an unrealistic thin body condition. The second is universal multi-risk factor programs. So in this program is lower effectiveness compared to other approach in reducing risk factor for eating disorder. However, this program is very easy to accept in community, especially in children and adults. The last one is media literacy based prevention program, which is this program targets individuals who have ideologies about thin body condition that adapts various approach to educate and strengthen these individuals. So that's all from me. Thank you.
Okay, thank you for the opportunity. My name is Valentino Chandra Wijaya, with the last digit of NIN number is 116, and I will summarize what has been discussed in this student project. So, anorexia nervosa is a type of eating disorder which is defined as a person's inability to control their fears of gaining weight. And this disorder occurs more often in adolescents between the age of 15 and 19, which are dominated by women compared to men. This disorder caused by several factors such as biological factors, psychological factors, and also environmental factors. Anorexia nervosa causes disturbance in several systems such as the serotonin system and also increased dopamine and also lesion in the brain. Anorexia nervosa is influenced by several psychological factors such as emotional factors and also cognitive factors. And this disorder is also related to medical aspects such as how to diagnose and then how to treat and also medical consequences. And anorexia can be prevented by carrying out several appropriate intervention programs and also prevention programs. Okay, so that's presentation of our student project. Thank you for listening and have a nice day. Thank you.